Welcome to the People's Health Briefing, a component of the Trusted Voices campaign. I'm Dr. Noha Abalata from Roots Community Health Center, reporting for the week of February 26, 2024. Following an update on COVID, flu, and RSV, I will discuss where we are as it relates to measles. As health professionals rooted in Oakland, serving some of the people most vulnerable to getting and suffering from COVID-19, we're here to cut through the noise to give you information you can use to make choices that will keep you, your loved ones, and your community as safe as possible. COVID is still with us. It's still causing sickness, disability, and death, and there is still a lot we don't know. The goal of the People's Health Briefing is to empower you with our best knowledge and thinking every Tuesday morning. Starting with COVID, nationally, wastewater viral activity remains high, and that is shown in the black line, which we can see is trending down along with all other regions in the United States except the South, which is the region with the highest wastewater SARS-CoV-2 levels, shown in the purple line. And not only is the South the highest, it also appears to be sort of heading up there. So not sure what is going on in the South, but we will keep an eye on that. And weekly new COVID hospital admissions continue coming down, which is great. We're just under 20,000 hospital admissions for the week ending February 17th. This is the 6th week in a row that COVID hospitalizations have decreased, so let us hope that trend continues for a while. And finally, some good news related to COVID deaths. This is the 2nd week in a row we are seeing declining COVID deaths after 7 weeks in a row where deaths were increasing. So the week ending January 27th, we still had over 1,800 deaths, but at least we are finally heading in the right direction. And this is consistent with the pattern we've been seeing where deaths lag behind hospitalizations. And in this case, deaths peaked about 2 weeks after the peak in hospitalizations. And we know we can prevent many of these hospitalizations and deaths by reducing transmission of SARS-CoV-2, staying up to date on vaccination, and by accessing timely outpatient treatment. Now, taking a look at variant proportions, JN.1 is edging out all the other variants, and it is forecasted to be at 96.4% of specimens. It's hard to say what will come next with variants, but I think we can agree that it would be nice to just have one variant and see it stay stable for a while. This would make things more straightforward and certainly simplify our vaccination process in terms of not having to be chasing after so many variants. But there's certainly not any reason why new variants wouldn't crop up and cause us trouble. But at this point, it does appear that JN.1 is outcompeting the other variants for now. It's dominant, and hopefully that will make it more difficult for another variant to gain ground, but we will continue to keep an eye on that. And now taking a look at influenza in the United States for the week ending February 17th. Over to the right, we can see flu cases do seem to be coming down, so hopefully that trend will continue. But as we've seen, it can kind of go up and down before it goes away for the season, so we'll continue to watch. And the week ending February 17th, there were over 10,000 patients admitted to the hospital with influenza, roughly the same as the week prior. So far this flu season, there have been an estimated 280,000 flu hospitalizations and 17,000 flu deaths. 91 of those were pediatric deaths. And we know that many of these deaths and hospitalizations are also preventable with the vaccine. Not too late to get those, recommended for everyone 6 months and up throughout the flu season. And taking a look at RSV nationwide, we can see that it finally is coming down nicely. So hopefully this will continue to get down to 0 as RSV does between seasons. So for our usual respiratory pathogens, I think we can anticipate over the next couple of months that both flu and RSV will get down to 0 or thereabout, and we'll continue to contend with COVID year-round with fluctuations throughout the year, and we'll be keeping an eye out for other respiratory illnesses like human metapneumovirus, which we haven't seen too much of where I am, but we do tend to see it from winter to spring or so, so we'll keep an eye out for that. And now I'd like to take a little time to talk about measles. I think we've probably all been seeing some headlines really from all over the the world that we're seeing an increase in measles. We started seeing reports from the UK last fall that they were experiencing and have been experiencing increasing cases and outbreaks. The UK has reported several hundred cases of measles since October, and they are reporting that this is due to low vaccination rates against measles. And just over the past couple of months in particular, we've seen outbreaks here in the United States in 15 different states, a total of 35 measles cases so far in 2024 as of February 22nd. We know we've added more since then. By comparison, in 2023, in all of 2023, we had a total of 58 measles cases for the entire year. So 35 so far in 2024 and counting. But still, 35 measles cases might not seem like a big number. So you might be wondering, why are we hearing so much about measles in the headlines and why are we talking about it today? And really, this has to do with the trend and what this may mean if this truly is a trend for us going forward. And this is because, in part, here in the United States, we have maintained measles elimination status for almost 2 decades. So even though every year we do have some cases of measles that basically get brought over here or imported from other places, it has not resulted in sustained transmission in any geographic area in the United States for any long period of time. And of course, we would really like to keep it this way. And we've been able to keep it this way for nearly 2 decades because we have enjoyed high vaccination rates against measles. So before I get into those details, I just want to explain a little bit more about what we mean when we say elimination and actually go through a little bit of the glossary of terms that you may hear sometimes about infectious diseases and the different statuses. So when we say that we have control over a disease, it means that we've been able to reduce it. We've been able to reduce how many new cases there are and how many people are getting sick or dying to an acceptable level, which is somewhat subjective, but that this is control that we're achieving as a result of some deliberate efforts that we're making, some interventions which have brought things under control, and that you have to continue those interventions in order to maintain the reduction. So I think most would agree that SARS-CoV-2 is really not controlled, and actually flu and SARS-CoV-2 are two vaccine preventable diseases and deaths that are actually not really controlled because we have not been able to effectively reduce transmission. And as we've seen, we have quite a bit of hospitalization and death that is occurring. And so I think most would agree that SARS-CoV-2 is not controlled because we really have not reduced transmission. And we still have quite a bit of hospitalization and death that's occurring and keeps going up and down. And we really haven't been able to get it under control. The hope is that we will implement some measures to achieve a reduction in infection and disease, like better indoor ventilation across the board, or maybe even a vaccine that can really prevent infection and bring things under better control. But one example of something that we have controlled would be diarrheal diseases. And so there are certainly parts of the world where these are not controlled. But here in the United States, through our different interventions like clean water supply, we have control over diarrheal diseases. So these aren't gone. We contend with them from time to time, but we have them under control. Elimination of a disease or infection is when some of those specific deliberate efforts result in getting the disease or the infection down to zero in a defined geographic area. And as I mentioned, measles is something that we were able to eliminate in the United States based upon this definition about 2 decades ago. Another example is polio in the United States, which we eliminated over 4 decades ago. Another example is malaria, which we managed to eliminate in the early 50s. And the thing about elimination and that is that it does require continued effort so that transmission is not reestablished. And that is what we're concerned about when it comes to measles, and for that matter, polio or anything else that we've managed to eliminate through vaccination. Because if we don't maintain those high vaccination rates, then we risk losing that elimination status. which means that we would be at risk of transmission being reestablished and sustained in parts of the United States. And I'll talk more about this in a moment. But next, we have eradication. Eradication is when we permanently, worldwide, get rid of an infection caused by a specific agent through, again, deliberate and specific efforts. And unlike elimination, once it's eradicated, we no longer need any intervention measures. It's gone, and the only place you can find it is in the lab. And the only example that we have of eradication of an infectious disease that affects humans is smallpox. It's no longer found or transmitted anywhere in the world, and it can only be found in the lab. And in the United States, that is in Atlanta at the CDC. And any research done with it apparently has to be approved by the World Health Organization. And lastly, extinction is when the infectious agent just no longer exists anywhere, not in nature, not at the lab, not anywhere. And we do not have any examples of that. So I'm sure by now you've seen in the news that there is an outbreak of measles in the state of Florida. And it looks like it's up to 8 confirmed cases and 1 probable case. So probably 9 cases, and this is in Broward County, Florida. At least 5 of those cases were from a particular elementary school. And since then, there's been a case of someone under 5 getting measles, so not a student at the school, obviously, and then also the suspected case is someone between 20 and 24 years old. Now, we know that measles, it's basically the most contagious thing out there. One person can spread it to many, many susceptible people in a very short period of time. And even after they leave the room, they leave behind infectious particles that can infect susceptible people. People who are not protected from measles by either having been infected with it before or having had the vaccine, 90% of them will get measles if they're near someone who's contagious. So highly contagious, and if you're not protected, you're really not protected. 90% of the time you will get the measles from that person, from that contagious person. The vaccine is not perfect, but it is about 97% effective at preventing measles. So one of the most important things to say here is that this is not a reason to panic if you have received the measles vaccine or if you had measles as a child and survived, or if you had measles at any point and survived, then there really shouldn't be much for you to worry about. However, if you have a child who's under 1 year of age, meaning they're not old enough to have started the vaccine series yet, or if you're not vaccinated, then certainly being exposed to someone with measles could be life-threatening. And I will talk more about that in a moment. So we know that there have always been people who don't get the vaccine for one reason or another. Maybe they have a medical reason why they can't get the vaccine, in other words, a contraindication to the vaccine. Or maybe that was just their decision, which in many places before now meant that you couldn't enter school and you'd need to instead be homeschooled. But as long as enough people in the population have protection, then we have what we call herd immunity. You probably remember hearing a lot about herd immunity early in the pandemic when we thought we could achieve it against SARS-CoV-2. That was not possible. But for the measles, we have achieved herd immunity. And this is why we've been able to reach elimination status for the past couple of decades. According to the World Health Organization, we need to have at least 95% of the population vaccinated against measles in order to keep and enjoy that herd immunity, which helps protect even those who are not protected with the vaccine because, or the 3% who didn't get protection from the vaccine, because we were able to stop it from spreading like wildfire. Now, another reason why we've been able to maintain elimination status is because we've been very diligent about controlling outbreaks. And there are specific definitions of measles outbreaks, but basically it has to do with cases that are related to one another, indicating that there has been local spread or spread from one person to the next. And when there is a suspected measles outbreak, the idea is to nip it in the bud before it goes too far. And the big concern is that it's not clear that this is what's happening in Florida. And in fact, some of the guidance that has been issued, or a lack thereof, has caused some great concern. In a nutshell, Florida seems to be doing its own thing, going in against any established public health principles, protocols, anything on how we reduce harm. Specifically, Florida Surgeon General issued a statement essentially saying that parents could decide whether or not to quarantine their children or just let them go back onto school, even if they're unvaccinated. This is dangerous, especially for those unvaccinated children. It's dangerous to not quarantine those who've been exposed because they can then go on and infect unprotected individuals. And this just goes against the very, very basics. What we're supposed to do is identify people who have measles, identify those who have been exposed, and isolate and quarantine. And we are also supposed to ensure that those who have been exposed but are unvaccinated get access to what's called post-exposure prophylaxis, which may end up being the measles vaccine itself. But this is in order to give protection from then developing measles. And if we catch it quickly enough, then we can provide that post-exposure prophylaxis. And in fact, if you receive post-exposure prophylaxis, then the quarantine period gets shortened considerably. From the usual 21 days down to potentially just a few days. And in order to facilitate all of this, you would have to notify people that they may have been potentially exposed. You might recall back in January when I reported about a measles outbreak in Philadelphia. So I just wanted to share here the City of Philadelphia Public Health Department putting out a bulletin and doing what is normal, what we normally see a public health department put out when there is a measles outbreak, which is all of the locations and the time and date of the locations where people may have become exposed to measles. And this is a really important part of our ability to contain outbreaks. And incidentally, if there are no more cases reported in Philadelphia next week, then the Philadelphia outbreak can be declared over. Measles outbreaks are considered over after 2 incubation periods with no new cases have elapsed. And as I mentioned, incubation for measles is 21 days. So after 42 days with no new cases that are associated with this outbreak, then they can declare that outbreak over. And it appears that Philadelphia is taking the normal steps to contain this outbreak. And so I'm certainly hopeful that next week they will be able to declare that outbreak ended. Now, about 1 out of every 5 measles patients will be hospitalized. Now, one question we're getting is, well, is measles really that dangerous? People used to get it back in the 50s, or maybe I got it back in the 50s and I did fine. And I will mention that I'm glad that people who got it and survived are now fine. Not everyone is, not everyone survived. And that is a pretty common bias. It's actually has a name. It's called survivorship bias. And it's where because you survived something, then you kind of shortcut and think that it's not as dangerous as it potentially is, or because you knew people who survived, or because we're only looking at people who survived. We're not even counting the people who didn't survive. And so that's not an appropriate way to be looking at an infectious disease or how we should be approaching it. And it is a common bias that we should make sure that we don't fall victim to. Measles is in fact dangerous. It's highly contagious, as I've mentioned. And about 1 out of every 5 patients with measles will be hospitalized. 1 in every 5, and up to 3 out of every 1,000 patients will die. So that's roughly 1 out of every 350 people will die. And those deaths are typically from respiratory complications or neurologic complications. And about 1 in every 1,000 will develop swelling of the brain or encephalitis. And that can lead to convulsions, that can lead to intellectual disability, that can lead to deafness. There's also a terrible potential long-term complication. So you could actually think you did fine and recover from the measles, but then later develop a terrible, terrible fatal disease of the central nervous system called subacute sclerosing panencephalitis. This occurs later on in life. This is something we would really not want to see come back. This develops 7 to 10 years after the measles infection has been resolved. And up to 11 out of every 100,000 people are at risk for this. Really not something that we've seen very often, but it does happen. But especially now that measles has been eliminated, it's not something we'd see very often, but we definitely do not want to see it at all. Another thing that's important to understand is that measles can actually wipe out some parts of our prior immunity that we've developed. And so I shared a link to this article. The lead author is Dr. Minna, who I've cited a few times on the briefing because he has been a leading voice around COVID home testing. But he actually conducted this study pre-pandemic in 2019. It's very interesting. It's actually kind of frightening in that it shows that there are serious immune system effects of having a measles infection. If you're interested, it's linked in the post, but essentially bottom line is measles infection can wipe out a considerable amount of antibodies that protect us against infections with viruses or bacteria, and therefore will leave people susceptible to additional infections even after they're over the measles infection. So and then folks can succumb to those infections because it's like they've never seen it before. They no longer have the antibodies that were produced the last time they had an infection. So it really is beyond me why anyone would want to risk all of this, why anyone would want to expose themselves or their children to getting measles. The MMR vaccine has been around for a very long time. It is effective, it is safe. And measles is not benign. It's highly contagious and it can be very dangerous, as I've just outlined. And it actually seems as though we may be at a point where we might be sliding backwards. I reported this past November about the rise in exemptions for so-called philosophical reasons for kindergartners entering school. And this is resulting in a reduction in vaccination rates. And so I linked that prior briefing in case you want to check it out. But there might also be people who got behind on vaccination earlier on in the pandemic. We know that that happened and they need to get caught up. So we really want to encourage those folks to get caught up. But at the end of the day, reduced vaccination rates, whatever the reason, pose a threat to us all. Now, you may ask, well, if you're vaccinated, then why are you worried about what everyone else is doing? Well, as I mentioned, the vaccine is 97% effective. So that's 3% of people who did get vaccinated, but they will not have an adequate response to the vaccine for whatever reason. They are susceptible. I also mentioned babies under 1 are too young to be vaccinated, so they're susceptible. I also mentioned people who have a medical reason why they cannot receive the MMR, they are susceptible. Now, a lot of people have been reaching out to ask, well, what should they do if how do they know they still have protection from their MMR vaccine that they got a long time ago? I linked some pretty detailed information in the post about the MMR vaccine. And the bottom line is that if you had the MMR vaccine, the likelihood is that you are protected. Also, people who were born before 1957 are generally considered protection because before the vaccine era, measles was kind of like almost like a rite of passage. Everyone would end up getting it because of how contagious it is, and those who survive should have protection. But we do know that, for example, people who work in healthcare who were born before 1957, typically it's recommended that they actually get a blood test to see if they're protected because we would not want them to get measles after being exposed to a patient with measles. And in those cases, if there isn't any laboratory evidence of their protection, then they may need to get the vaccine. And that does happen sometimes. So the question becomes, if we start to see more and more outbreaks of measles, will we need to start recommending that people get their blood titer levels checked to see if they're protected? Well, as of right now, that's not the recommendation. But having said that, if you live in an area where there's a measles outbreak happening, especially in a place where they're taking normal precautions and measures, then some of these recommendations could get beefed up. For example, they could even recommend that children younger than 1 get the vaccine early. It's not ideal, but if in the setting of an outbreak where we're worried about them, then they may change those guidelines. So this is still kind of a case by case thing. It's going to depend both on what's going on around you as well as your individual circumstances. So if you're interested in more of those details, you can check out the link in the post regarding MMR. So we know that measles is very contagious, spread through the respiratory route. SARS-CoV-2 spread through the respiratory route, flu, RSV. And so we're going to want to maintain our best practices around preventing the spread of respiratory illnesses in general. And those would include vaccination, wearing a filtration mask like an N95 or a K95, gathering outdoors. This is almost always safer than indoors. Improve our indoor air quality by increasing ventilation. You can monitor your indoor air quality using a CO2 monitor, also having the appropriate filtration in your HVAC system or standalone HEPA filtration units. And we also want to consider testing if you have symptoms, testing for SARS-CoV-2 if you're someone who should be treated. Same thing with flu. If you have symptoms and you're someone who should be treated, you should know how to get to your physician or primary care provider to get those things tested and get treatment if it's indicated. If you are doing home testing, then please test out of isolation. Enough virus to detect is enough to infect. Let's remember to do what we can to avoid infection and reinfection. Catching COVID once and doing fine is not a guarantee about the next time. And every infection is a new opportunity, perhaps even a compounded opportunity for long COVID and post-COVID impacts. So let's please keep up our best practices to prevent the spread of all respiratory infections, but especially to prevent COVID and long COVID. And as usual, remember to eat a balanced diet, get some fresh fruits and vegetables, avoid those processed foods and sugary drinks, get some regular physical activity unless you don't feel well. In that case, please get your rest. If you're someone who should be treated, if you get COVID, you should know that now. And here are the approved treatments for those at higher risk of a bad outcome. And if you don't have a primary care provider, please get one, get your blood pressure and your baseline labs checked, manage those stress levels, and get a good night's sleep. This concludes today's People's Health Briefing. Thank you so much for joining us, and we'll see you again next Tuesday at 10 a.m.